Good day. Today we will be doing airway evaluation of a patient. So magandang araw po, sir. Ako po si Abe, isang clinical clerk na nag-rotate ngayon sa Anesthesiology. Ngayong araw po ay magkakaroon tayo ng eksaminasyon ng inyong pong bibig, bunganga, at ang inyong leeg. Huwag po kayong mag-alala dahil lahat po na mangyayari dito ngayon ay magiging sa atin lamang po. Kung sa panahon po na sa examination ngayon ay makaramdam kayo ng may masakit o hindi kayo komportable, sabihan niyo lang po ako. Mari na po ba tayo magsimula?
Sige po.
Okay po. Ideally, the examiner and the patient should be wearing personal protective equipment during the examination. But for this video, both of us are wearing face mask and I'm wearing gloves. But we could also wear hair cap and other PPEs that may be needed. Before doing the physical examination of the patient's airway, we have to elicit first the airway history in order to elicit problems with airway management. So, sir, naoperahan na po ba kayo dati or na general anesthesia? Yung parang pinapatulog po kayo bago kayo operahan?
Opo, noong 2019, tinanggal ko yung appendix ko.
Okay. So, nagkaroon pala kayo ng appendectomy noong 2019.
Opo.
Kumusta, sir? Ano po ba sabi ng doktor niyo noon? May nasabi ba siya na parang or ng anesthesiologist na may nasabi ba siyang problema sa daluyan po ng hangin niyo?
Wala naman po.
Okay po. So, the patient had an appendectomy in 2019 under general anesthesia, and so far he recalled that there was no airway problems during the induction of the patient. To assess for potential difficulties for bag valve mask ventilation and laryngoscopy before attempting intubation, we have to check for predictors of difficult mask ventilation, such as presence of facial hair or beard, obesity, edentulous patient, or history of snoring. So sir, ano pong timbang nyo ngayon?
78 kilograms po.
78 kilograms. Ano pong height nyo or tangkad nyo po?
172 po.
So 172 centimeters. Okay po. May nabanggit po ba sa inyo na kasama nyo sa bahay kung humihilik kayo?
Opo. Minsan po.
Minsan. Okay po. Sir, pwede kong makita rin pala yung, pwede paalis mo na ng mask niya, sir. Okay, tapos patingin ng ngipin. Okay, sir. Pwede na pong ibalik. So, the patient has no significant facial hair or beard and is not edentulous. His current weight is 78 kilograms and his height is 172 centimeters. And that would make a BMI of about 26. And by World Health Organization standards, that would be overweight but not obese. And the patient also shared that he has a history of snoring. We will now proceed with the physical examination of the airway. So the first part of the physical examination of the airway is mouth opening. So here we try to assess the extent to which the glottis exposure can be blocked by the maxillary teeth. So we ask the patient to sit upright in a neutral position, and later we ask the patient to measure the mouth opening, which should be at least 4 centimeters or 3 finger breadths. So sir, pwede pakialis po muna ng mask ninyo. Ayan. Tapos sir, gayahin niyo po ako yung 3 finger breadths. Yan, 3 po. Tapos subukan niyo pong ganito. Okay na po. Ayan. So, the patient's mouth opening is 3 finger breadths, or that would translate to at least 4 centimeters, and below which there would be difficulty intubating the patient since the glottis exposure is blocked by the maxillary teeth. But for our patient, the mouth opening is at least 4 centimeters since it's 3 finger breadths. So the second part of the physical examination of the airway is the determination of the Mallampati score. So the Mallampati score tries to assess the extent to which the tongue prevents the visualization of the pharyngeal structures. So higher Mallampati scores indicate poor visibility of the oropharyngeal structures, attributable to a large tongue relative to the size of the oropharyngeal space and subsequently a more difficult laryngoscopy. So for our patient, in order to determine the Mallampati score, the patient should be sitting upright, and then the head is in neutral position. And sir, paalis mo na ng mask. Yan. And the mouth should be fully opened and the tongue should be fully extended without phonation. So sir, bukas nga po yung bibig ninyo. Ayan sir. Pabuka ng bibig sir. Sige pa sir, kung kaya pa. Tapos labas dila. Okay. Okay na sir. So for our patient, since the hard palate, soft palate, and the upper portion of the uvula is visible, the Mallampati score of our patient is 2. And upon also evaluating, the patient does not have other predictors of difficult intubation such as long upper incisor, prominent overbite, or highly arched or very narrow palate. The third part is the measurement of the thyromental distance, which should be at least 6 centimeters or 3 finger breadths. A thyromental distance that is less than 6 centimeters is suggestive of difficult intubation. So for our patient, sir, pakialis po muna ng inyong mask ulit. Yan. Pakitanggal na lang po. Yan. In order to determine the thyromental distance, the head should be fully extended. So sir, ganito nga po kayo. Sagad niya sir. Yan. Sige, tingnan kayo sa taas. And the thyromental distance is measured along the line from the thyroid cartilage prominence and up to the lower border of the mandibular mentum. Yan. With the head fully extended. So, okay na sir. So, for our patient, it's 4 finger breadths. So, which is at least 6 centimeters. It should be noted that a small mandible can lead to inadequate glottic visualization and tongue obstruction, which can impair the view during intubation. On the other hand, a large mandible can contribute to a difficult airway by elongating the airway axis and also impairing the visualization of the vocal cords. The fourth part is the neck mobility. So the ideal position for direct laryngoscopy requires that there is 35 degrees of neck flexion and 15 degrees of atlanto-occipital extension. Neck immobility interferes with the alignment of the oral, pharyngeal, and laryngeal axis. We can also use the Bellhouse door classification in order to predict difficulty with intubation based on the ability of the patient to extend the neck. So, sir, pwede niyo po bang itungo? Pwede po ba kayong yumuko pala? Yan. Okay, sir. Tingin po kayo sa taas, sir. Okay. Okay na po. So, based on the neck mobility of the patient, he would most likely have a Bellhouse door class 1 since there is no reduction in neck extension. And it was also noted that the patient does not have other findings that may suggest difficulty of intubation, such as short or thick neck and or lack of normal range of motion of the head and neck. It's also important to note that the Bellhouse door classification would have class 4 for patients with cervical spine fractures or trauma. We should also note that when there are burn patients, they would most likely have difficulty to extend the neck and would most likely have higher Bellhouse door class. The last part is the upper lip bite test, which assesses the patient's ability to place the lower incisors over the upper lip. So this acts as a predictor to subluxate the mandible during laryngoscopy. Sir, maaari niyo po bang parang kagatin yung inyong labi sa taas gamit yung mga ngipin niyo sa ibaba? Yan, parang ganyan, sir. Ayan. Patingin nga, sir. Ay, sige. Okay na po. So we also have a grading system for the upper lip bite test. So for our patient, since he is able to fully cover the upper lip with the lower incisors, The patient's upper lip bite grade is grade 1. In summary, the patient's airway history is unremarkable. He had an appendectomy under general anesthesia in 2019 and recalled no mention of previous airway problems. He has no significant facial hair or beard and is not edentulous. So the patient is also overweight and has a history of snoring, which is one of the predictors of difficult mask ventilation. For the physical examination of the airway, the mouth opening is 3 finger breadths or at least 4 centimeters. The Malampati score is 2. The thyromental distance is 4 finger breadths. The Bell-House door classification is class 1 or no reduction in extension. And for the upper lip bite test, the patient was able to fully cover the upper lip with the lower incisors. And that would be grade 1 in the upper lip bite test. Also, the patient does not have other findings that may suggest difficulty with intubation, such as long upper incisors, prominent overbite, highly arched or very narrow palate, short or thick neck, or lack of normal range of motion of the head and neck. So that ends our airway evaluation. Maraming salamat po, sir.
Ang galing po.
Let's go.